We're now averaging 20,000 COVID hospitalizations a day. That's much lower than the peak that we hit during the Omicron spike last winter. It just about matches where we were last summer as Delta began to surge and sent patients to the hospital. COVID deaths are still trending slightly downward at the moment, a bit of a relief as we mark a total of 1 million dead from COVID this week in the United States. We've done a lot to defang this virus. This is not spring of 2020. We've got the tools we need to test, to treat, and to prevent the virus from overwhelming us. So this upward trend of cases and hospitalizations may not be all that alarming, at least not in the United States where testing hadn't tapered off, or where social COVID protections hadn't dropped, or where Congress had actually passed the funding needed for more vaccines, treatments, and tests, and where we weren't all expecting an even bigger COVID wave in the fall. But unfortunately, we don't live in that United States. We live in this one, where the White House's recent multiple pleas for Congress to please pass COVID funding have gone unheeded. Why? Because of a lot of Republican senators who insist on retaining a public health measure that would continue to keep immigrants south of our border for no particular reason. They've hitched that public health measure to the COVID funding bill, and they're not letting up. But they are pretty severe consequences for not funding more COVID relief. According to Politico, the White House is now preparing to ration vaccines because this 50-50 Senate can't do its job and pass the funding for pandemic relief. As current funds run dry and additional money is stalled in the Senate, we might have to limit access to our next generation of potentially variant-specific vaccines. In other words, providing providing those vaccines only to those who are at the highest risk of severe illness and death. The reality is the $10 billion stuck in the Senate is stuck. It's just a starting point. That's only enough to pay our debt to Pfizer for its antiviral COVID treatment pills and to maintain our current levels of supplies of vaccines and tests through the end of the year. We'll need more money beyond the current funding in question. So how do we get past this logjam? And more importantly, what happens if we don't? Joining us now is Dr. Anthony Fauci, the nation's top infectious disease expert, President Biden's chief medical advisor, the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, thank you for making time to speak with us tonight. It's an honor to have you here.
Thank you, Ali. Good to be with you.
Let's understand this business about what happens if Congress continues to sit on this COVID relief funding that the White House has asked for. What, in your opinion, is at stake, and how soon do we need to be worried about it?
Well, it's going to be a real problem if we don't get the funding we asked for. And as you mentioned correctly, Ali, that's the minimum we're talking about. We need even more than that. And what's going to happen is that the vaccine, particularly the boosters against the variants that we're going to need, we're not going to have enough. The drugs that we need, the antivirals, we're not going to have enough. The tests, we're not going to have enough. These things are going to run out pretty quickly. And this is well, first of all, it's an inopportune time to run out of funding no matter where you are, but particularly now, as we're starting to see, as you mentioned just a moment ago on the introduction, we're seeing increase in cases. We're seeing increases in hospitalizations. This is not the time to pull back or not allow us to get the resources that we need. This is going to be a serious issue very soon if we don't get those resources.
When you see these increases in hospitalizations, despite the fact that we've got antiviral treatments, we've got vaccines out there, what does it tell you? Because on one hand, it looks like we're dealing with an attenuated virus where the effects on many people are not that severe. On the other hand, we're still dealing with numbers in the tens of thousands. It's remarkable.
Well, Ali, true, there's a significant amount of background immunity in the general community, resulting either from prior infection and recovery, and also from the number of people, not as many as we'd want, but a significant number of people, 67% of the population is fully vaccinated. But because we don't have a substantial proportion of those people boosted, even the good, hearty, robust immunity that we've had tends to wane over time. So we're seeing a conflation of issues. We're seeing a variant, the sublineage of Omicron, that has a transmission advantage. It transmits more readily. We're then seeing waning of immunity, and we're seeing a situation where we don't have as many people vaccinated as we'd like. And the hospitalizations and the deaths that you're seeing predominantly are among the vulnerable, the elderly, and those with underlying conditions. Sadly, even those who have been vaccinated. So there are a lot of things that we can do and we need to do. And unfortunately, in this country, compared to other countries that are developed and rich countries, the total proportion of people that have been vaccinated and boosted is below where we would like to see it. Put all those things together, and that's the reason why we're seeing this surging of cases.
How does this play out for you? Because what tends to happen here is right about that moment where everybody thinks we're out of this thing, and people decide they're going to go about their lives and go back to the office or drop some of their social distancing. We then see a new iteration, in this case, a sub-iteration of Omicron. How does this play out for you? Are you worried? Do you think this just peters out over time, or are you worried that we do see a spike again in the fall?
Well, we certainly have the possibility of a surge in the fall. And again, Ali, it's going to be related to a couple of conflating factors, because the fall is several months away. If we don't get people who've been who've been vaccinated to be boosted, and getting the people who've not been vaccinated, we're going to have a degree of immunity that's below the level of what you want for the community protection across the country. Then you get a situation, besides the waning of immunity, where as the weather gets cooler, people tend to congregate indoors. And we've seen very clearly a relaxation of some of the mitigation, where people are going to indoor congregate settings without masks. Now, masks are not required in so many places, but people are not wearing masks, particularly when you have vulnerable people. You can get infected and yourself get into serious trouble, or you could inadvertently bring it back perhaps to a household in which you have a vulnerable person, either an elderly person or someone who has an underlying condition that makes it more likely when they do get infected that they have a serious outcome. So we're concerned about all of those things. We're concerned about the surge we're seeing right now, as you mentioned, and the fact that as we approach the fall, the late fall and early winter, we're going to have a waning of immunity and circumstances, namely a lot of indoor activities, which make it very conducive to another surge.
So is everybody who is qualified for a second booster, should everybody who's qualified be getting one now, or do you hold off and wait till fall when it could become more serious? Or do you think there'll be, is there discussion of yet another booster? How does that all play out?
Well, Ali, getting a booster now, if you are qualified or eligible, as it were, to get a booster, is not going to impede or get in the way of a good response if all of a sudden, as we get into the fall, there's the recommendation that everybody gets an extra shot. So right now, as we know, a few weeks ago, the FDA and the CDC made it very clear that people older than 50 years old are eligible for a boost, with a particular emphasis on those who are quite old, in their 70s and older, and those who have underlying conditions. If those people get a boost now, and then as we get into the fall, namely the end of September, the beginning of October, and we need an extra boost, there's no contraindication for those people to also get another boost then.